So what does this mean for you? Well, we're here in Chicago, and most of these camps are in Wisconsin and rural Wisconsin. And the way you get to rural Wisconsin is you go to the middle of nowhere and then hang a left. So they don't have a lot of options in terms of local places, but there's plenty of other places that have camps throughout the summer, and some of them may be close to you, and some of your patients may be going there. I know that we got contacted by places in California that were more than willing to have us perform the same services, but we just couldn't afford to get camp license, state licenses for California, which is really what we needed to do to satisfy all of those camps' needs. It was kind of expensive. There was a time crunch, so we didn't think that was possible. Wisconsin has a very nice setup where, because we're in Illinois, because of the pandemic, because it's all telemedicine, there's an understanding. You just fill out a little form and that's it. Same for Minnesota, same for some of the other states. So here in the Midwest, it really wasn't a big deal. If we wanted to go further away, like California, it is a big deal. So wherever you are, the Pacific Northwest, California, the Southwest, New England, the South, there's places around you, obviously, where kids go to camp, and you might be better positioned to, be the telemedicine doc. You gotta, as Russell said, you gotta make sure that the licensing thing and the liability is all set. Make sure your insurance, malpractice insurance carrier knows. Make sure you're not, skirting any rules about licenses. But once you get all those ducks in a row, and if you have time, a year from now for next summer, then then you're good to go. And I got to tell you, so based on our experience last year, and again, it was limited because, as I said, there were only a few camps and they had a very brief period. Once camp starts, I'm going to breathe a big sigh of relief. I've been in charge of getting all of this set, and every day I feel like there's some sort of new crisis. But once camp starts, then I'm not going to worry about it anymore because that's the easy part. There's not that many calls. And the calls that do come in, it's pretty straightforward. It's a rash, it's poison ivy, it's a cold. Does he have strep or doesn't he have strep? It's pretty straightforward stuff. If it's not, then there's only so much that you can do with telemedicine, right? Kid was jumping on a trampoline, fell down, can't bear weight on his leg. His ankle's big and swollen, and looks like it might be broken. Okay, then he needs to go to the urgent care or ER that's close and get an X-ray. There's only so much I can do. So some of the more acute or more serious stuff is going to be handled by the urgent care or ER anyway. They know that. They just don't want to have to go for all the little stuff that we can handle, and we can handle very easily with telemedicine. The one thing I will say is this. We've been doing telemedicine with our patients, like I said, for whatever it is, 15, 16 months. At the other end of at the other end of the call is a mother or father, almost assuredly is not a medical professional, who can barely take a pulse. We're lucky we get a temperature right. Now with camps, when we're doing this, we've got an experienced camp nurse on the other end who can, look in a kid's ears for me and tell me what she sees, who can listen to his lungs and say, this is what I hear, who can get a good blood pressure and all the other vitals. So this is almost easier than what we've been doing for the last 16 months in terms of assessing the patient. So it's great to have a medical professional on the other end, let me tell you. And so really that's about it. I would encourage you to think about this for next summer. It's a little late for this year, obviously. But it is another way to get your name out there. It's another way to bring in some revenue. And it's just a good use of telemedicine for these kids who, if you can keep them from going to some ER where they will get probably shoddy care because it's in the middle of nowhere, or a retail-based clinic, that it's not quite a medical home, but you're going to be providing better care than those other places, I guarantee it.